You're much more likely to be accommodating and desiring closeness and community and willing to put up with bullshit that one would not put up with if you did not have these hormones constantly telling you that you have to reproduce and care for things. And after menopause, when that stops, a lot of women kind of come out of this fog and they're like, hold on, there are things about my life that just are not fair because I've been giving too much because of this urge to caregive and take care of. I can say now, a year later, this is the best I've ever felt. It's the most self-confident I've ever felt. It's the happiest I've ever felt. It's the most grounded I've ever felt because hormones mess up your brain. Not everybody, but they sure were messing up mine.
Oh my God, now I can't wait to go through menopause. Welcome for another episode of Insights from the Couch. We have Dr. Laura Meyers, clinical psychologist with over 20 years of experience, specializing in anxiety-related disorders, PTSD, OCD, and is board certified, Linhan board certified in dialectical behavior therapy, and is an expert in the treatment of high emotion and high-risk populations. Welcome, Laura. We are so excited to have you.
Hi, thanks. It's great to be here.
Laura is someone I reach out to periodically just to talk about cases because she's just so wise in all things anxiety and behavioral stuff. So let's get started.
Yeah, we're very lucky to have you with us, Laura. And I think our audience is in for a big treat. Your knowledge base is so deep. And I think this information today on anxiety, depression, and how menopause, this midlife phase, really affects our mental health is going to be so valuable to so many.
Good. I really hope so. Yeah, it's a really crucial time in life, and a lot of people don't talk about it or don't understand it at all. So I'm really glad to be able to help get the word out there.
Let's dive in.
Sounds good.
What drew you to wanting to work with high emotion, high risk populations? That not everybody signs up for that.
People don't. I mean, I think it's several factors. I mean, I think first of all, I've always liked doing hard things. That's just my personality. I like it because when you can really help people that a lot of other people don't want to work with or are anxious to work with, or there's so much stigma around, the reward is kind of proportional to the amount of work you put into it. And it just feels so incredibly satisfying and rewarding to be able to help people that other people are afraid of or don't want to work with. And I think for me, especially being drawn to people who've had trauma, it really is this feeling of people who through no fault of their own, just roll of the dice, are in this really challenging life circumstance that any one of us could be in if we were born into that situation or that with that biology. And so I kind of view my role as in this world as leveling the playing field a little bit, being willing to do the hard things in order to help people that otherwise may not get help.
I love that.
Me too. Thank God for people like you, because, some of our listeners may not realize, but the therapy field is broad and wide and no one specializes in everything.
Absolutely.
So, what you do and your client population versus mine as a couples therapist versus Laura's as an individual therapist, can be very different. And these specializations are really important. And it can be particularly important for somebody who's seeking therapy to know what to look for. So maybe you can speak to that a little bit in terms of your own experience and your approach.
Exactly. I think that there's a lot of misperception in our, TikTok online world where anyone with a microphone can say whatever they want. And we haven't really figured out yet in this virtual post-COVID, lockdown age of how to really tell, how do you know if you're not an expert in something? How do you know that someone really knows what they're doing or that they specialize in what they say they do? What does a certification even mean? Certifications are all over the place and they mean such different things because there's no regulation of the standards for it. So I think what's really important as someone looking to go into therapy is to not think that your therapist knows what they're doing just because they're a therapist. There's a lot, just like any other field. There's a lot of great therapists out there and there's a lot of terrible therapists out there. And I think when you come to someone in emotional pain, that's a really hard position to be in, to feel like, well, who am I to interview them? But that's really the perspective you have to take when you're looking for a therapist. Any therapist who's good at their job will welcome being interviewed by you. And by interviewed, I mean things like asking, what is your experience with this population? These are the kinds of things I'm dealing with. How do you approach that? Like, what is your approach to see if you feel comfortable with how they treat it? And one of the most important questions that I think no one knows to ask is, how long should this take? And how do you decide if it's not working? I can't tell you, having worked both in the public and private sectors, how many times I've met people who have been in therapy for years and they feel better when they go to therapy, because it always feels good to have someone listen to you and soothe you and tell you wonderful things about yourself. But they're not learning anything. They're not learning new skills, or, it's analysis paralysis. You analyze everything, but nothing changes during the week. And then you just keep going back to therapy. And that to me is tragic. So any therapist should be able to tell you, how do you know when this is not working? How would we decide that you're not a good fit, or this approach isn't a good fit, and that I should work with somebody else or try something else?
Wow. So even for anxiety and depression, right, which are the most common things that can bring people into therapy, it's really important to ask your therapist about their approach. Do you work with people typically who have these issues, and how am I going to know if this is working? Not just coming to therapy and feeling soothed by the process. It's so true, Laura, that of course therapy is going to feel good if you're connected to your therapist, but we really want to empower people to get better and to have agency in their own lives.
Exactly. We don't want you to feel connected to your therapist. We want you to feel connected to your life.
Yes, and yourself.
Yeah. It's all about building a life worth living. And a life worth living is more than just feeling good 1 hour a week.
Right.
Especially with something more general like depression or anxiety, which so many people come to therapy with. There's so many different approaches and styles out there. I think a lot of people assume it's like a medical model where you go in and you see your doctor, and if you have some kind of problem, you get penicillin and you don't beat the infection and you're done. But mental health is so different than that. There's so many different approaches. There's so many different philosophies. There's so much varying levels of how much therapists care about research or are even aware of research. I think that that's really important to know, that if you think your therapist might not know what they're doing, you should trust that. Give it a shot. Move on after a couple sessions. If you're just like, they're not giving me anything other than someone nice to listen to me.
Right. So, trust your gut.
Yeah, definitely believe yourself. Tell me about what your sort of framing around anxiety and depression is and how you work with that.
So my philosophical approach is cognitive behavioral therapy with an emphasis more on behavioral, meaning that my approach, my training, going through graduate school, it was very much a focus on what does the research say? And CBT has the strongest quantity of research behind it as effective modes of therapy. And then how are these emotions, how are these things you've learned, how is the biology in your body all coming together to create an emotional experience that can be effective given a certain set of circumstances? It's doing what it's supposed to do. It's helping you the way it's supposed to help, versus ineffective, where you've learned things that aren't helpful, from your childhood or from past trauma or from your previous relationship that cheated on you, and so seeing things through that lens of previous learning, it's understandable to feel anxious, or it's understandable to feel depressed, but is it helping based on your life now? Or is it because of your past and you're seeing it through the lens of your past? So the core of behaviorism is that people do what feels good and they avoid what feels bad, like on a very basic sort of level. But fortunately, as human beings, we also have our prefrontal cortex that can help us decide, is this really helpful or not? And is this something that I actually want to act on or not, because it fits my current situation, not my past? So that's a little kind of analytic there, but that's kind of the basic thing. So it's not like emotions are good or bad. It's not like you really have these like subconscious desires, because who knows what that is anyway. But it's like, is this helping you in your life right now? And if not, you need to change how you feel by changing what you do, the behavior of it, as opposed to needing to feel differently first before you change anything in your life.
Right. Which is hugely empowering, because at the end of the day, every action, there's a choice.
Yep.
regardless of how you're feeling. And actions are what create then further feelings and thoughts that lead to more positive actions. So you can really see how this approach could lead to a cascade of positivity, both in behaviors and in thoughts and feelings when implemented from that angle.
Absolutely. Because, from a biological perspective, emotions are here to help us. They're here to help
Right.
us avoid things that really are dangerous when we feel fear, or to apologize for something when we've messed up, when we feel guilt. These are all things that are adaptive and helpful, and emotions are they're as good as how they're functioning in this particular situation. And it can be so empowering to be able to back up and not treat your emotions as facts, which people just instinctively do. Emotions, like anything else, are tools to use. There are ways of increasing positive emotions in your life, and there are ways of decreasing negative. And you can think of yourself as sort of the emotional wrangler of your life, as opposed to needing to be controlled by them.
Like, to that like whole TikTok notion, I think there's just a really in the zeitgeist that everything, we have to go back to the source. We have to like do our deep work.
Yeah, no.
Understand, analyze, uncover the inner child. Not that I have anything against, I'm IFS trained. I like a lot of that. That's internal family systems and, EMDR models of, that's like more deep work. But there is something so crucial to like actually changing behavior to gain evidence for new ways of functioning. There's no way around that.
I would argue that behaviorism is incredibly deep work. Like, I don't know anyone who, is doing really hardcore true behaviorism to actually take control of your mind and your emotions and say, I'm not going to just do what they're telling me to do. And I don't need to understand where this comes from in order to take control of my life. I just have to face this.
Yeah.
That is the most intense, awe-inspiring experience to have, to see someone who's terrified of something face it and not be afraid anymore. Like, that is really deep work. That is really feeding the wound.
I love it.
They don't even need to understand what happened when they were 4 that caused them to be afraid of dogs. We just have to go face dogs and learn that they're wonderful in every way, and pet
Right. All deep work considered, right? Like the psychoanalytic idea of understanding the root and all of this insight, I just don't think that actually leads to results. That's my personal opinion.
And research would support your personal opinion.
Yeah.
There's this common phrase in CBT world of analysis paralysis, that a lot of people want to come in and find out, where does this come from? Why do I feel this way? And there's this sort of cultural programming that if you just know where it comes from, that suddenly you'll feel differently and it won't have control over you anymore. Whereas what research, and that can be interesting. It can be helpful to understand and to have a conceptualization like, yeah, I'm suspicious of my husband when he's coming home late from work because my last ex cheated on me. That's helpful insight to have. It makes it easier to act differently. It is not necessary to act differently. And if you only have that insight, but you're still tracking your husband's phone and checking his emails and yelling at him every time he comes home, that insight does nothing. You have to change your behavior in order to change your life.
I love it. So let's just like turn a little bit to talk about, because I know that one of the things when I was asking you to come join us is that women in anxiety are something that's just such a common space. And then when we reach midlife, and especially like perimenopause and menopause, anxiety and depression is something that a lot of women can like suddenly experience.
Yes, that is absolutely true.
Yeah. And all these hormonal inflection points become these, interesting times where you can really go down. Your biology can, and your hormones can pull you down to a place that maybe you're not used to being. And you had said like that happened to you. So you have like a personal experience with that.
Well, let me just back up a little bit first. So as all emotions have a function and a time they're helpful versus not helpful, anxiety is helpful when there is a problem to solve. Anxiety motivates us to put attention on a situation that is solvable and it's productive to analyze and figure out and then take action. That's sort of the theme of my whole life. Take action on the thing that you're anxious about. Anxiety becomes problematic if there isn't a problem to solve and you just feel this discomfort and spinning and all of that. Or if you solve the problem and it's solved as much as it can, but you won't accept the aspects that can't be solved, that we don't have control over to fix, and then you spin and spin and spin. So that's when anxiety is problematic. Same thing with depression. Depression, like no one would call someone depressed if their, spouse just passed away and they're grieving at the funeral. That's not depression, that's grief. And that's normative and that's helpful. Grief allows us to mourn and process and heal from things that are important to us that have been taken away, whether it's a death or a disappointment from losing a job. All of these things are things that it is normative and helpful to feel sadness around. Depression is when there isn't something you've just recently lost, or you have grieved it, but you're not really accepting that it's truly over. So you keep ruminating and stewing on it. It no longer becomes helpful for healing and actually creates more pain. So that foundation is helpful to understand because as women move into perimenopause and menopause, these dramatic biological changes can happen in a woman's body where they just suddenly start feeling anxious without a specific target, or they start feeling really sad or grieving without having lost anything. And it can be really confusing if people don't understand that emotions aren't facts, that emotions are things that you feel, and then you have the autonomy to decide if this emotion is helpful for you versus this is just weird biology insanity that I don't understand and it's awful, it feels terrible, and it's not helpful to act on because the emotion isn't functioning accurately the way it should. So that's just kind of my spiel of like how I approach emotions and think about it and approach therapy and what the research would support of what's helpful to move forward in life. Menopause was an incredibly intense experience for me. So I'm 46, so I'm definitely on the earlier end. The average age for menopause for women in America is 45 to 55. And so I was not prepared because I grew up in Minnesota, and as all good Midwestern people are, you do not talk about sexual things. You do not talk about the functioning of women's bodies.
Right.
It's just uncomfortable. So why would we discuss this? Now, this being said, I am a very opinionated person. I'm a very educated person. I've learned all sorts of things in my career about menstruation and pregnancy and hormones and sex and all of this stuff, totally comfortable with. Our society is so far behind on dealing with menopause.
Yes.
I have never experienced what I perceived as sexism holding me back in anything I wanted in my life until I hit menopause. It was that I really just felt like we live in an incredibly sexist society because I was completely unprepared. Despite everything I'd read and everywhere all the therapy sessions I've done and all the people, hundreds and hundreds of people I've worked with over the years, no one had brought menopause into the therapy room. No one trained me on it or said this is something we should screen for or talk about.
Right.
I thought menopause was hot flashes, just based on what you see in sitcoms or the little one-liner jokes that women have. I thought that was it. And oh my gosh, is that not true? And I should say too, it's a huge range. Women experience it very differently, just like everything else. Some women, it's no big deal at all. And it really is just like minor hot flashes, if anything, and they coast through it and it's just fine. That was not the case for me. And for a lot of women, it's gradual, like where you have some symptoms. I think that's more common. You have some symptoms and then they kind of ramp up and all of these things. No. So for me, a year ago, all of a sudden it hit me like a brick wall, like in the span of a week. All of a sudden, I started having really intense hot flashes, but not just hot flashes. They were followed by freezing flashes, which I had never heard of before. And they were happening like every 3-ish hours. So all throughout the day, I would have like a couple minutes of feeling swelteringly hot and then a couple minutes of feeling freezing cold. And during the day, it was just annoying. At night, it was terrible because I'd wake up every single time. So I was waking up every, 2 to 3 hours throughout the night. Plus, I had horrific insomnia. So, which is also a really common symptom of menopause that I had no idea about. So I'd be up really, really late. I couldn't get to bed until like midnight, 1 o'clock, which isn't typical. I would fall asleep and then be wide awake at 4 a.m. And that, I mean, I'm someone that needs like 9 hours of sleep a night. So for me, like that alone is enough to make anyone feel terrible. Then here was a really fun one. I started feeling nauseous like when I was pregnant. Did you know that can be a symptom of menopause? And I was nauseous for like an entire week without a break. I thought I had the flu. I did not. This was just the hormones like switching things up, like making me feel nauseous.
Wow.
But for me, the absolute worst part was the incredible, humbling level of change in emotions. So I had not seen this coming at all. I've had periods of more mild depression or anxiety in my life, never at the level where I couldn't get out of bed or couldn't function or things like that. This was like knock you on your ass horrible. Sorry, can we swear here? I don't even know.
Yes. Swear away.
It is impossible to explain the menopause experience without the swearing. So I'm glad this is
Agreed.
So there was just all of a sudden this shit ton of symptoms. And the worst one was that I would feel incredibly depressed, like barely get out of bed. Like I felt suicidal. I have a ton of skills, so I never would act on it, but I wanted to die for no reason other than biology. I'd get through my workday, drag myself through by my fingernails, get into bed and watch, back-to-back episodes of Afterlife with Ricky Gervais because that dark humor just made sense to me.
Totally.
It would switch up and I'd feel horribly guilty for periods of time. And then I would feel horribly enraged. I have never known anger like this in my life, where like I would just like yell at my husband, which is not me at all. Like it just would come on me like a fire. So all of this, like it really made me feel a very strong awareness and empathy for people who struggle with biologically based mental illness, because I'd never experienced something like that before, even though I've worked with it my whole career. And it was so humbling to experience how hard it is to keep functioning, to do things differently when your emotions are just screaming at you to do something else or to give up, or it's pointless, or everything's a tragedy. What are you going to do next? You have to fix it. So yeah, so that was my initial experience with no preparation, nowhere to go, and then just the cascade of terrible experiences trying to get help for it. But that may.
Wow, Laura, thank you for sharing that with all of us, because I think we need to understand that these things do happen to people. So somebody who might have some or all of that same symptomology doesn't feel so alone. And I wonder, as you were going through that, at what point, if any, did you realize, this is menopause, or was it only later that you realized?
No, I knew that this was not right. Like it was, but I could see where it's more gradual, you wouldn't know.
Yeah.
But for me, because it was everything at once, and I think because I did know about hot flashes because that came on so intensely, I'm like that has to be what this is. And then because of the kind of person I am, I immediately started reading, and I found out that like, holy shit, all of this is normal. Like this is typical, and it's not just something that's like a week or a month. This can go on for years.
Yeah, years.
Cannot do this for years. This is, if men went through menopause, there would be dedicated
treatment centers,
for them with like trained individual case carers that would soothe them and give them massages and make decisions for them. And of course, you would have leave from work that would just be paid for, way better even than delivery. But no, because it's about women and we don't value women who are older. And that was something too. Like I noticed my internalized shame, because women are taught that we are only worthwhile as long as we are young and beautiful. Yep. And menopause is a signal that you are no longer young. And I felt this incredible embarrassment and shame talking about it to anyone, because I felt like something was now wrong with me, that I no longer had the same value or worth that I did before, because now I can't have any more kids. Like it's actually a great thing. But it felt like, I'm not good enough anymore. So
I no longer have the value or currency as a woman that society says makes me valuable.
Exactly. Yeah. And this is not me. I mean, I realize you all listening have known me for half an hour. This is not me. I am not someone at all that places value on physical appearance or, those kinds of things. But that was how I was feeling because it was all so intense.
And you can imagine that like so many women who have put their value on that, that it's even more intense.
Yeah, it just ramps it up, which of course then creates this spiral. I mean, it's pretty well established that emotions are the product of biology and environment. It's not just one or the other. So you have someone who may have more of a biological predisposition to anxiety or depression. Certainly, studies have found that that absolutely amplifies and is more common throughout menopause as well. Or, you have someone who has really difficult life circumstances and already has a lot of stress or already has a lot of stigma where my value or my worth is my body or is my appearance. Of course, that's going to just skyrocket it off the charts.
It can be such a vulnerable period. I'm like remembering because it's so funny as you say you weren't prepared for menopause, and I'm not prepared either. Like I think of it in terms of hot flashes, but I had a mother who really did go down with menopause and had a new marriage. And I don't think she'd mind me telling this story. I think she'd love to tell it herself. Had a kind of a new marriage and found that she was headed into menopause. And she's somebody who really couldn't, and we'll talk about hormone replacement in a second, but she got on hormone replacement probably too early. And she had an experience of going way up and not a history of anxiety or depression. Like she had been pretty stable throughout her whole life. And it really sent her down. Like she just crashed somehow and was really clinically depressed for like the better part of a year and suicidal and had never been suicidal. Yeah. But I mean, I should be more concerned having had that, or be more aware of it.
Laura, I think you should. Awareness is always great.
Awareness, yeah.
If you're more concerned, that becomes anxiety because who knows
how
the body's going to react. And sorry, there's nothing you can do about it.
Right.
At this point, being concerned isn't going to do any good because there's truly nothing you can do to like be prepared for something that may or may not be problematic.
Good point.
Wonderful to be aware.
Having the awareness in advance is great, but the perseverating on it is really only going to spiral you into anxiety. I mean, I had a mother who has told me she went through menopause very late. She said she didn't even know when she went through it. She didn't feel any different, didn't disrupt her sleep, didn't have hot flashes. Eventually her periods were spaced out and disappeared over a couple of years, and it was a non-event. And I have thought to myself, God, please let me have inherited that genetic piece of lottery. But who knows? So what I want to ask, based on your incredible story, Laura, which sounds like it was really just such a departure from your normal baseline mental health and experience of moving through the world. And people may experience a variety of symptoms from nothing like my mother to more of what, both of you Lauras are describing, your experience and your mother's experience. What did you find that was helpful to you to climb out of this that some of our listeners may be able to take away as what they can do if menopause is hitting them hard?
One of the main skills that I love so much in behavioral therapy or in DBT specifically is a skill called opposite action, meaning that when you can kind of back up and see that your emotions are not functioning the way they're supposed to, or they're not functioning in a helpful way, you do the opposite. And this is the most powerful when the emotion you're experiencing is learned. It's harder when it's biological. But when the emotion you're experiencing is learned, so like I learned that I was worthless or less worth. I didn't get totally worthless, but less worth because I'm now old and cannot reproduce, what my brain told me.
Right.
That is something I learned. That is not biological. So I was able to observe and notice that, which is very CBT, using mindfulness, kind of backing up, taking space, noticing that wasn't helpful and doing the opposite, which is what I'm doing right now, which is talking about it all the time.
Yes.
I love that.
When you feel shame is functioning to when it's accurate. It's letting you know that this group of people would reject you if they knew what was going on.
Right.
So my feelings were justified, it would be like if I went and told a group of people I was going through menopause and they were like, oh, well, then we don't want to talk to you anymore because you're just kind of gross. That would be justified shame because it's doing what it's supposed to do.
Right.
That is not the case with menopause. That is not the case with anyone that you want to have in your life. So, and if they do react that way, lovely screener, kick them out.
Right.
What I did is I immediately told good friends, male and female, I am so embarrassed telling you this, and I'm embarrassed that I'm embarrassed because this is not the kind of person I am or who I want to be. And obviously, they were very supportive, very validating, sent me all these videos to cheer me up or to be there for me. And it was really powerful. Like it makes me tear up a little just thinking about how powerful it was to say the unsayable thing and then have a new learning that actually all that stuff I learned before was bullshit. And it doesn't mean that you're less worthy. But if I never acted opposite and told people, I never would have known.
Yeah.
And my insight would have been pointless. So now I'm thrilled to be able to talk about it here. I've told waitresses at, at restaurants, like I'll go and like read books because I like devoured books when I learned about this. So I'm like, okay, I got to take like a graduate crash course in this right now. I cope with things. Read all this research so people would see me reading it and I'd feel embarrassed that, oh, they see I'm reading a menopause book. It's like, oh no, I'm going to tell them all about it. So that's been really super helpful. I found 2 books that I just want to recommend that were just incredibly helpful.
Please do.
One is called The Menopause Manifesto by Gunter, and that is more of a very factual, evidence-based, biological, what does research say? A lot of research that you read about through like the news or newspaper articles is very fear-based. That if you go on any kind of medication, you're going to get breast cancer or you're going to get dementia or I don't know, fill in the blank, like because sensationalism sells. So when people are summarizing research for the general population, they tend to summarize anything that could be negative or they misrepresent the level of risk because that's more likely to get viewers. And the Menopause Manifesto was very balanced and very feminist. And I loved that because that's just really needed in this area. So it was very empowering to read like just a summary of all the data and the facts and all of that. The other one that took a bit more of a spiritual approach is The Wisdom of Menopause by Northrop. And
I love her work.
A really long time. Yeah. And has gone through many iterations. And that she's also an MD, so has that scientific medical background, but also speaks to more of the spirituality of it. One change that I'll say, I'm getting a little tangential here, but it was just fantastic. One change that I noticed that she said in her book, and I'm not aware that there's like hardcore research to support this, but it makes a lot of sense. She said that after menopause, there's this social stigma that, women go crazy or they become, just horrible to live with or all of these things. And her thing is that when you go through menopause, you're no longer experiencing the monthly influx of hormones that creates this evolutionary feeling to want to care for others. That when you want to care for others, you're much more likely to be accommodating and desiring closeness and community and willing to put up with bullshit that one would not put up with if you did not have these hormones constantly telling you that you have to reproduce and care for things. And after menopause, when that stops, a lot of women kind of come out of this fog and they're like, hold on, there are things about my life that just are not fair because I've been giving too much because of this urge to caregive and take care of. And that was so true for me. Like my husband and I have totally had to rework. I mean, he's a wonderful, wonderful person. He is not at all sexist or anything. But even with that, we've really had to restructure our marriage in the last year. And it's been actually great. It's been really empowering. Because like, what have I been doing in the marriage because of insecurities or because of a deep need of I have to be good at everything and care for everyone or I'm not good enough? That's gone. And I did not realize how much those hormones were affecting me because, I felt that way since I was 13. I don't know what I felt like when I was 10 and didn't care about anybody but myself. So I'm like, I can say now, a year later, this is the best I've ever felt. It's the most self-confident I've ever felt. It's the happiest I've ever felt. It's the most grounded I've ever felt because hormones mess up your brain. Not everybody, but they sure were messing up mine.
Oh my God, now I can't wait to go through menopause.
It's fantastic. Go. Going through it is horrific. Getting out on the other side.
It's
wonderful.
Yeah. I mean, there's research to support that. Like women do get happier in their 50s and 60s.
I think the link that they're missing is a lot of it is hormonal. That when you're not feeling this hormonal urge to caretake and to sacrifice for other people over yourself, it's pretty awesome. I still love my kids and everything, but it's just much more balanced.
Yeah, I was thinking very jokingly, and obviously everyone is not in heterosexual relationships, but or they get happy because the men in their lives die.
Well, I mean, I'm not there yet.
I'm kidding.
No, I
and
know.
I too have a great husband. But you know, there is something then very liberating about not feeling biologically driven.
Yep.
On top of everything else society tells you about how women are supposed to put their needs last.
Yep.
You know, when you can finally feel free of that and just sort of stand in yourself on your own terms without that pull.
For being okay and being alive instead of having to get your self-worth from achievement, which was more me. You know, I've never been someone to really get my self-worth from like being a mom, kind of not in that like traditional way. I can't cook at all. And so I had to give that identity up a long time ago. But for me, it was more like accomplishing. Like I always have to get the next promotion or, you know, get the next raise or oh my gosh, I'm so freaking busy or was so freaking busy. Like, I'd have a private practice on the side and traveling around doing trainings around the country. Like, why? Some of it's because it's awesome, but other parts, it was because I didn't feel good enough unless I did it. And I don't feel that way anymore, which is pretty fantastic. And I love it.
Did you do some work? Like, was this stuff that you processed through yourself or did you do like any therapy around this?
I've done therapy in the past. Being a psychologist, most of my friends are therapists. So I have a wonderful advantage of most of my support system already, knowing all of the things that one would learn in therapy.
Yeah.
And I have a PhD in behaviorism. This is our clinical psychology, which was very behavioral. I could not know these techniques better, really. And it was really hard. So that was one of the most invalidating experiences is because when I finally did get in to see a medical doctor, which of course, took a month and had to survive that month and got there. And then she wanted to do blood tests, even though everything I read said those are inconclusive, don't really say anything, but all right, she's not willing to prescribe anything until we do blood tests. And then she's like, well, have you considered like doing some self-care?
Oh yeah.
Or have you considered like maybe seeing someone yourself to get support or, maybe taking some time off of work? I'm like, okay. I could not know these skills better. And last night I kicked my husband out of the house, told him to go F himself, took apart the lock on the door so he couldn't get back in because I thought he needed some thinking time. I don't think some yoga on the beach is going to touch this.
Right.
And so I think she kind of stood back a little bit because she didn't, I don't think she was used to that kind of answer. But it really was this feeling of like sometimes telling me to have self-care was incredibly invalidating.
Totally.
Yeah.
Telling women sometimes, well, are you taking care of yourself? Filling yourself. It's very helpful and important, but if that's what you're telling someone because they have a broken leg, no, they need to go get their broken leg fixed. Like that's the problem. You don't need to go do meditations. So I've done therapy in the past a couple times at various life transitions. At this point in my life, it was very fast and very clear what the issue was. And I needed my whole army of therapist friends to get me through it. And I really just needed to get on some really good hormones. And that solved the problem for me.
Yeah. How quickly did you feel better? Like,
and this is so different for so many women.
Yeah,
but
of course.
that I think is empowering. So a lot of people, when one opposite isn't working, so it's not working to tell women that you have to stay home and take care of your children or you're not worthwhile and you have to be attractive and you know, all that. A lot of times people will then do the opposite to try to balance, but it's the same set of problems. So a lot of very well-intentioned wanting to empower women people will go to the opposite side and say, oh, no, you can't do that. You need to do this. So like, it's not, you can't just, they're just loading you up with drugs. It's terrible and awful. The whole system is trying to mess with your natural biology. Your body knows what it needs. You really just need natural. You really just need herbs and you need to go into the forest and, all of that.
earth, ground.
That's equally problematic. It is
Totally.
not empowering to tell a woman that there is one right way to do this, and if you don't do it this way, you are wrong. The middle ground is do your own reading, find doctors you trust, figure out what works for you. For me, reading the research on hormone replacement therapy, I believe the risks are very low, especially relative to the risks of the very real daily suicidal fury, nausea, hot, cold flashes, not sleeping. Like that's 100% risk right there. Yeah. So the very small increase in risk later on, and those studies are looking at ages. If you go on hormone replacement therapy under 50, the summary of research I have read is that it actually decreases risk of osteoporosis and it doesn't increase risk of breast cancer at all.
Right.
So I was all about hormone replacement therapy because clearly this was the problem. I wanted to get on this. They said it took up to 3 months to work. That felt like an eternity to me. I could not imagine feeling this way for another day. For me, I felt markedly better after 4 days. It was like I started on a patch. 4 days later, it was like the fog had lifted and I would say like 60% better. Wasn't normal.
Wow.
60% better after 4 days. And then it gradually kept improving. And it did reach kind of maximum effectiveness around 3 months, where I would say around 3 months, I felt like myself again, like how I was before hitting that menopause wall. And then it just kept getting better. So I don't know what was happening. Again, I think it was because I stopped having those monthly cycle hormones kind of messing up with me. But I would say by 5 or 6 months, that's when I started to feel like just the incredibly awesome, empowered person that I feel like today. Though I still have issues. Of course, I still have my moments, but way less.
But that's incredible that you felt such a profound change even after 4 days, even though you weren't all the way there.
Yes.
Yeah. And I love what you're sharing about, do your research, think about it from every angle, and you've got to find the solution that's right for you because nobody is going to have the exact same symptomology, pre-existing biology. You got to really find not this black and white, you're either doing nothing and you're Mother Earth or, you're on all these extreme measures.
Yeah.
And maybe some takeaways for our listeners, it seems to me, is that, you're a clinical psychologist. Like you said, you know these skills so well. You have this huge support network of trained therapists in your life. But, the average person, if you're not already in therapy, it really may be a time to go to therapy.
It's kind of what I said at the beginning. The core bottom line is, how will you know that this is working? And when will you stop it if it's not? Because so many people, if one drug isn't working, they don't stop that drug and try another one. They just add another drug. And then they just have all these things and they're suddenly on this huge cocktail and who knows what's really helping or not. Or they've been on, the same meds for 10 years and they never try, well, is this really what I need? I can say if I didn't already know CBT, if I didn't already know these skills, it was life-saving. It truly was. It allowed me to continue working. It allowed me to use the opposite action to shame and guilt and the opposite action to depression and anxiety to have an honest, direct conversation with my male older boss, who's a wonderful person, but a really frank conversation of what I was going through. Oh, it was awesome. The women's clinic wouldn't sign FMLA paperwork because they only do that if it's pregnancy related. I'm like, okay, so you only support women if we're actively reproducing, even though you recommended that I take some time off work. That is fantastic.
That's disgusting.
Yeah.
And I used CBT not to burn the clinic down. So it's very helpful that I had these skills and was able to do what was effective instead of what my emotions were telling me to do. So I found a different doctor and I love my doctor now. She's phenomenal. Anyway, so my boss was very understanding. I think he was incredibly worried about getting some sort of EEO complaint or something. He was just darling. But he said he'd let me do whatever because the main thing I needed and what I needed to admit in my shame is my insomnia was so bad that I really needed like 1 or 2 afternoons a week that I could nap in order to function because my exhaustion was so extreme. Once I asked for and started to do that, it helped so much. But it was my shame stopping me because I felt like I take time off work, I'm weak, I'm not good enough, I'm not being responsible. But that was what was effective. And it made me so much more effective the whole rest of the week to have that 2 to 4 hours to nap once or twice a week for those months while I was getting ready for or building up the hormone replacement level. Um, it was crucial, but I wouldn't have known how to do that if I didn't know CBT.
Yeah.
Or all the times I felt suicidal, CBT allowed me to keep working. I did not have to take long periods of time off of work. It allowed me to stay married. It gave me the skills to apologize after I had these like rageful moments. It allowed me to learn when the rageful moments were coming on. And, pretty quickly, I got to a point where I would just say to my husband, like, you need to leave me alone for 2 minutes and I will be fine, but you cannot say anything else right now. And that worked instead of just going off on him. And it did work. 2 minutes is all I needed. I knew the tip skills, the dive response where you can put ice water on your face and it triggers to your body that you have to be in survival mode. It sucks all emotion out of you. Like these are all skills that most people don't know. And these skills didn't make me feel better in this particular situation because the feelings were very biological, but it made me function and it made my life not be worse.
Yeah.
And that was what I desperately needed. So absolutely, if women are going through any percentage of what I just talked about, CBT is incredibly helpful to learn how to deal with and regulate and minimize the unbelievable suffering and pain that these emotions can cause for you.
That's a great pathway that if you're struggling with some of this and menopause or perimenopause is affecting your mental health. I mean, I think two pieces. One, look for a therapist, and cognitive behavioral therapy or CBT can be enormously helpful. So you can look for a therapist who's trained in that, specializes in that. And then also, I think what you're saying is the pathway to seeking this help, which is if you're feeling that shame, that learned shame around this phase of life where society has decided too pervasively that middle-aged women should shrivel up and die, recognize that as a learned thought and emotion cascade and do the opposite. Ask for help, seek help, get curious, embrace what you're going through. Know that the distorted thoughts about how you'll actually be received are just that, distorted by that internalized shame. And, find a therapist, find a new doctor if your doctor is gaslighting you, which unfortunately does happen even from female doctors. Yeah, I just had it happen to me yesterday. It's really annoying. And, it's the way the world works. But find that help and figure out what's going to work for you, because it doesn't have to completely destroy your life, even if it's hard.
Yeah. Be your own advocate. Another thing that we talked about also is the idea that like there's been such like this woo-woo industry around menopause, like that you can eat more kale and you can just take some supplements and like, you have to be like a savvy consumer. I'm sure you did.
I mean, there is a freaking wall of supplements at Walmart that are supposed to help menopause. I was eating them like Skittles. Did not touch me. So I'll try anything. Try your kale.
Yeah.
But, oh my God, there's nothing wrong with you if kale doesn't cut it. And that really should have a bumper sticker somewhere.
Amen to that. There's nothing wrong with you if kale doesn't cut it. I love it. I think we should make t-shirts.
Well, let's make that on a t-shirt. Yeah.
I think that is a great t-shirt idea. Yes.
And I'm just so grateful that you're willing to open up both as a professional and as a woman who had a really harrowing, difficult experience, because we do need to talk about menopause. Normalize it, embrace it. There is nothing wrong with going through this process. And in fact, again, it's really hopeful because on the other side of all this turbulence is this wonderful change of being at peace.
Oh, awesome. Postmenopause is, oh my gosh, I've never been this happy.
There's a book that needs to be written, the postmenopause mindset.
Or not. I don't feel like writing a book because I don't need that self.
Yeah.
But it's like, just go live your life, make your life being instead of accomplishing. And it's wonderful. It just feels wonderful. And one of the best moments that let me know I was dealing with it well was last year for Mother's Day. My daughter in the card, she said, "Thanks for being a good mom, even though you're going through menopause." That right there is just like
chef's kiss.
Yeah.
Yes.
Well,
Oh my
I think
gosh.
that is the perfect note to wrap up on. Laura, thank you so much. This has been so helpful. I mean, honestly, it was helpful to me as somebody who probably menopause is imminent for at 50 years old. And I just started taking progesterone at my endocrinologist recommendation. So I'm just wading into this territory. And this conversation just made me feel so much better about, not getting worried about it, but being aware. And then I'll be able to figure out what I need when and if I need it.
Yep.
So thank you.
Yeah,
Absolutely.
we just need to
Thank
keep
you.
talking about it and normalize it.
Thank you so much for inviting me. It's been great to talk about.
Thanks for being here.